I want you to recall a moment that has probably happened to you recently. It might have been yesterday afternoon. You were sitting in your favorite armchair, perhaps reading a book or watching the news. The phone rang in the other room, or maybe the doorbell buzzed. Without thinking, you stood up quickly to answer it. In that split second, everything changed. The room went dark around the edges. Your vision turned into a tunnel. A wave of lightheadedness washed over you, making your knees feel like jelly. You had to reach out and grab the back of the chair or lean against the wall to keep from collapsing. For a few terrifying seconds, you weren't sure if you were going to stay conscious. Then, slowly, the fog cleared, your vision returned, and you went about your day, telling yourself, "I just got up too fast. I'm just getting old." I am here to tell you that this phenomenon is not just a quirk of aging that you should ignore. It is a distinct medical condition called orthostatic hypotension, and for people over the age of 60, it is one of the most dangerous physiological events that can happen in the home. It is the silent precursor to the fall that changes everything. We often talk about preventing hip fractures by removing rugs or installing grab bars, but we rarely talk about the internal mechanism that throws you to the floor in the first place. That feeling of fainting isn't just clumsiness, it is your brain being starved of oxygen because your blood pressure plummeted the moment you stood up. Today, we are going to dissect the hydraulics of your body. We are going to explain why your internal blood pressure sensors get lazy as you age. We are going to discuss the dangerous role of dehydration and medication. And most importantly, I am going to teach you specific physical maneuvers, counter-pressure techniques like the glut squeeze, that you can use every single time you stand up to manually force blood to your brain and prevent the blackout. By the end of this video, you will know how to rise with confidence, ensuring that you stay on your feet and out of the hospital. To understand why you get dizzy, you have to think of your body as a water bottle that is half full. When you are sitting or lying down, the water, your blood, is evenly distributed. It is easy for your heart to pump blood to your brain because they are on roughly the same level. Gravity isn't fighting you too hard. But the moment you stand up, gravity takes over. In a fraction of a second, gravity pulls about 500 to 800 milliliters of blood, that is almost a quart, down into your legs and into the deep pool of blood vessels in your abdomen. It drains away from your head. In a young, healthy body, this isn't a problem. A young body has a lightning-fast reflex system. There are sensors in your neck and chest called baroreceptors. They sense the drop in pressure instantly. They scream at the brain, "Pressure dropping." The brain sends a signal to the heart to beat faster and to the blood vessels in the legs to clamp down tight. This pushes the blood back up to the head before you even notice anything happened. It takes milliseconds. But as we age, this system gets sluggish. The baroreceptors become less sensitive. They are like an old thermostat that doesn't click on until the room is freezing. The nerves that carry the signal to clamp the veins are slower. So, you stand up, the blood rushes down to your feet, and your body pauses. It hesitates. For those few critical seconds, your brain is deprived of oxygen. That is the dizziness. That is the tunnel vision. If the pause lasts too long, the lights go out. You faint. This is called syncope. And if you faint while you are halfway to a standing position, you fall hard. You don't have the reflex to put your hands out. You hit your hip, your head, or your shoulder. This is how independence is lost in the blink of an eye. We need to talk about the post-meal slump. Have you noticed that this dizziness is worse after breakfast or lunch? There is a reason for that. It is called postprandial hypotension. After you eat, your digestive system needs a massive amount of energy to break down food. To help with this, your body diverts blood flow to the stomach and intestines. It opens up the floodgates in your gut. This means there is less blood available for the rest of your body, including your brain. If you eat a large meal and then stand up suddenly, you are fighting a war on two fronts. Gravity is pulling blood to your legs, and digestion is pulling blood to your gut. Your brain is left with the scraps. This is why many falls happen in the early afternoon. Let's address the medication cabinet. This is the great irony of modern senior healthcare. We are terrified of high blood pressure. We spend our lives trying to lower it to prevent strokes and heart attacks. So, your doctor prescribes beta blockers, diuretics, water pills, and calcium channel blockers. These drugs do their job well, they lower your pressure. But sometimes, they work too well. They keep your pressure artificially low. They prevent your heart from speeding up when it needs to. Beta blockers, specifically, act like a governor on an engine. When you stand up, your heart wants to race to pump blood up to your head, but the beta blocker says, no, stay slow. The result is a blackout. Diuretics dehydrate you, reducing the total volume of blood you have to work with. If you are on these medications and you are getting dizzy, you must speak to your doctor. You might need an adjustment. Do not just stop taking them, but do not suffer in silence either. There is a balance to be found. Now, let's talk about the solution. How do we fix this broken hydraulic system? We cannot make you 20 again. We cannot replace your baroreceptors. But we can use mechanical tricks to do the job that your nerves are failing to do. We can use your muscles as a pump. The most effective tool you have is the muscle squeeze. I want you to practice this right now while you are sitting. Before you stand up, I want you to wake up your legs. Step 1, pump your ankles. Flex your toes up toward your shins, then point them down. Do this 10 times vigorously. This activates the calf muscle pump. Your calf muscles act like a second heart. When they contract, they squeeze the veins in your lower legs and shoot blood back up toward your torso. Step 2, the thigh and glute clench. This is the secret weapon. Before you rise, and while you are rising, I want you to clench your buttocks muscles as hard as you can. Squeeze your thighs. Imagine you are trying to crack a walnut between your cheeks. Why does this work? Because the biggest muscles in your body are in your hips and legs. When you tense them, you are physically compressing the blood vessels inside them. You are preventing the blood from pooling downwards. You are forcing it upwards. If you feel dizzy after you are already standing, do not try to walk it off. That is a mistake. Stop moving. Cross your legs while standing, like a scissor, and squeeze your thighs together hard. Tense your butt muscles and your abdominal muscles. This maneuver can raise your blood pressure by 10 to 15 points instantly. It pushes the blood out of the lower body and up to the brain. It can stop a faint in its tracks. We also need to rethink the way you get out of bed. The morning is the most dangerous time. You have been lying flat for 8 hours. Your kidneys have been filtering urine all night, so you are dehydrated. Your blood pressure is naturally at its lowest point. If you hear the alarm and jump out of bed, you are asking for trouble. You need to follow the 3-stage rise. Stage 1, sit up in bed. Swing your legs over the side, but stay seated on the mattress. Wait for 1 minute. Let your body adjust to being vertical. Stage 2, do the ankle pumps. Wiggle your toes. Get the blood moving. Drink a glass of water that you keep on the nightstand. Stage 3, stand up slowly, holding onto the nightstand or the bed frame. Do not let go until you count to 10 and you are sure the world is stable. This adds 2 minutes to your morning, but it ensures you actually get to enjoy the morning. Let's go deeper into the hydration issue. I know, everyone tells you to drink more water. But for orthostatic hypotension, water is actually a drug. It increases blood volume. Think of the garden hose again. If the hose is floppy and empty, you get no pressure. If you fill it with water, it becomes firm and pressurized. You need to keep your blood vessels full. A specific strategy is to drink 2 tall glasses of cold water rapidly, within a few minutes. This has been shown in studies to raise blood pressure for about an hour afterwards. It triggers a sympathetic nervous system response. If you have a busy morning planned, bolus, drinking a lot at once, can be a protective measure. Salt is another controversial topic. For years we have been told salt kills. And for people with pure hypertension, that is true. But if you have orthostatic hypotension, if your pressure drops too low, salt helps you hold on to fluid. Some doctors will actually prescribe salt tablets or tell you to add a little extra salt to your diet to keep your blood volume up. This is not advice you should take without asking your doctor first, because you have to balance your heart health, but for some seniors who are fainting, salt is the cure, not the poison. Compression stockings. I know, they are tight, they are ugly, and they are hard to put on. But they work. They act like a constant muscle squeeze. They apply pressure to the veins in your legs, preventing the blood from pooling in the first place. If you are going to be on your feet for a while, or if you are having a bad dizziness day, thigh-high compression stockings can be the difference between staying upright and falling down. They are a mechanical support system for your aging veins. We also need to talk about the temperature. Heat makes blood vessels dilate. It opens them up wide. This lowers blood pressure. This is why you might feel dizzier after a hot shower or a hot bath. The heat draws the blood to your skin to cool you down, leaving less for your brain. If you get dizzy in the bathroom, you need to lower the water temperature. Finish your shower with lukewarm water to help tighten those vessels back up. And never, ever lock the bathroom door. If you faint in a locked bathroom, help cannot get to you. There is a psychological component to this condition called fear of falling. It becomes a vicious cycle. You get dizzy once. It scares you. So you stop moving. You sit in your chair all day. Because you are sitting, your leg muscles get weaker. Your cardiovascular system gets deconditioned. So the next time you stand up, the dizziness is even worse because your body is weaker. To break the cycle, you must keep moving, but you must move safely. You have to train your body to handle gravity again. Walking, even just marching in place while holding onto a counter, keeps the vascular reflexes sharp. Let's distinguish this from other types of dizziness, just to be clear. If the room is spinning like a merry-go-round, that is vertigo, inner ear issues. That is different. If you have chest pain or shortness of breath, that is a heart issue. Orthostatic hypotension is specifically the feeling of fading out or blacking out upon standing. It is a lightheadedness, not a spinning sensation. I want to give you a checklist for your next doctor's visit. Doctors often miss this because when they measure your blood pressure, you are sitting down. Your sitting blood pressure might be perfect, or even high. They don't see what happens when you stand. You need to ask for orthostatic vitals. This means they measure your BP while you are lying down, then again while sitting, and then again while standing. If the top number drops by 20 points or the bottom number drops by 10 points when you stand, you have a diagnosis. You have the proof. There are certain danger zones in your house you need to be aware of. The toilet is number one. Straining on the toilet, the Valsalva maneuver, triggers a nerve response that lowers heart rate and blood pressure. If you strain and then stand up quickly, it is a double whammy. This is why so many cardiac events and falls happen in the bathroom. You must address constipation issues with fiber and hydration so you don't have to strain, and you must use grab bars to stand up from the toilet slowly. The other danger zone is the church pew or the theater seat. Sitting still for an hour makes the blood pool. When the service is over and everyone stands up to sing or leave, that is when the drop hits. In these situations, act proactively. While you are sitting, pump your ankles. Squeeze your glutes. Keep the blood circulating before you ever attempt to stand. Let's talk about sleeping. Believe it or not, sleeping with the head of your bed slightly elevated can help. If you sleep completely flat, your kidneys work overtime to remove fluid. This is why you pee so much at night. This leaves you dehydrated in the morning. If you elevate the head of the bed by about 10 to 20 degrees, it tricks the kidneys into keeping more fluid in your body. It keeps your blood volume higher for the morning. I want you to think about the why behind all of this. Why does it matter? It matters because your independence relies on your ability to stand. If you fall and break a hip, the statistics are grim. A massive percentage of seniors never return to their own home after a hip fracture. The fall is the beginning of the end of autonomy. By managing this blood pressure drop, you are protecting your right to live on your own terms. This condition requires you to be mindful. You can no longer run on autopilot. You cannot hear the doorbell and jump up. You have to retrain your brain to pause. Phone rings. Stop. Sit up. Pump ankles. Squeeze glutes. Stand. It sounds tedious, but after a week, it becomes a habit. It becomes muscle memory. If you are watching this and thinking, "This happens to me every day," please take action. Start drinking the water. Start doing the muscle squeezes. Review your meds. But also, be kind to yourself. Your body has served you for decades. It is just a little slower to react now. You just need to give it a few extra seconds to catch up. Imagine the confidence of being able to walk around your house without that nagging fear of blacking out. Imagine knowing exactly what to do if the edges of your vision start to get dark. You are not helpless. You have the tools. You have the mechanics. You just need to use them. So, the next time you are comfortable in your chair and you decide to get up, remember, you are a pilot preparing for takeoff. Check your systems. Pressurize the cabin, squeeze your muscles. And then, ascend slowly. Your brain will thank you, and you will stay standing strong. Thank you for listening. This information is vital for everyone over 60. Share it with your friends. Teach them the glute squeeze. Let's keep everyone safe, upright, and healthy.